Afternoon, everyone, and we are ready to get started with Are We Results Oriented? Our speaker today is Barbara Mooney, who many of you know through several different capacities. So actually, I would consider that there isn't a whole lot of introduction needed, and I will let Barbara go ahead and talk about herself and the project that we're working on today. Barbara, I officially hand it over to you.
Thank you, Cashin. Hopefully everyone can hear me. Yes, I see a little green signal by my name, so that's a good sign. Today we're going to talk about a different way of looking at what we've at the ROMA concept. We often think about when we talk about results-oriented management and accountability, we often focus on the management and accountability aspects of that term, where we're looking at the quantity of the services provided, the costs associated with the delivery of the service, and this produces a set of facts related to outputs of an agency. There's quite a bit of that discussion that happens with the board members and the upper management staff of an agency. But I was privileged to be able to work on this toolkit that focuses on the first part of that term, the results-oriented part of the term. And one of the things that we hear a lot is, well, is it evidence-based, and how do we know if things happen or what the results are? And so we have a quote here on the screen from Lee Shore. No one questions the President's insistence that our public funds should go to programs that work. The question is how we know what works and what kind of evidence that prudent investors should consider credible. So we looked at this question, what are our results and how do we support them? And there are a number of different elements that come to play that we looked at, and it has to do with program evaluations. You'll see the boxes at the bottom of the screen here. Program evaluations, formal evaluations, other research, theories that are in the field that have to do with the work that we do, and then evidence from practice. So taken together, those kinds of evidence we use to think about this concept of what works. And so today we're going to focus on this important component that is the work of staff that serve customers on a daily basis. And you might hear me refer to this group of staff as frontline staff, but I think that might be almost a negative term, because it makes you think of the front line of a war, and it sets up a negative feeling about what the workers at that level are doing. And so I think I'm going to try to focus on the term direct service staff, so that we can have a more positive look at the staff that is providing service to customers on a daily basis. And we're going to look at things that include both the staff and agency assumptions and expectations. We're going to talk a little bit about skills, and we're going to talk about this strength-based approach and how that is important to the work that we do. A results orientation, really, if your agency is focused on results, then the way that services and strategies are implemented at the agency will be different than if you have a service orientation. And that's part of what we want to look at today. What's your orientation, and how does the strength-based practices help to improve agency outcomes? So So that's what we're going to look at, and we're going to introduce this guide that we've been working on called Utilizing a Strength-Based Approach to Implement ROMA Throughout the CAA. And you have a cover shot here of what the toolkit looks like, and it'll be available for you to use. If there's some activities in it and some theory in it that will perhaps help you think about these topics. And here are the basic topics we're going to cover today. This idea of a results orientation, and is there an expectation that things will actually change for the people that you serve? And then if you think that things will change, how does change actually happen? And we'll look at some results that have been identified, and we'll look at the strength-based approach. We'll talk about the health-giving cycle, make a connection to ROMA, and then talk a little bit about training for this direct service staff. So this is what I said earlier, that we usually think about management and accountability, but this toolkit focuses on the expectations for change. So we believe, and what the research shows, is that if you are going to achieve results, you must have an expectation that change is going to happen. And you can look at the achievement of results and collect that information and analyze that as we think about what's ROMA Next Generation about. And what it's about is analyzing the data, using the data that we've collected. And so looking at that data and saying, what results did we achieve, is the first step, but then that's followed by the question, how were those results achieved? Because remember, we want to answer the question, what works? So if we've got accomplishments and results that we're sharing, we want to be able to say, this is what produced those results. And so we want to follow the first question with the how are results achieved question. So how does change happen? I think that this is all, I'm probably, as they say, preaching to the choir here, but we need to start with the basics and then with the acknowledgement that if there is going to be a change in the person who's coming to get help from the agency, that person must acknowledge that they want a change to happen, and the worker has to acknowledge that there is something that needs to be changed, but also the agency has to acknowledge that. And if you've been hearing us talk about the theory of change over the past couple years with the NASCAS ROMA Next Generation Center of Excellence, then you'll know that we've talked about assumptions that are behind the agency's mission, that are behind the strategies and services that the agency selects to implement. And so there has to be some assumption that there's going to be change. If you have a service orientation, you may not acknowledge that there is a change that's involved in the process. So there might be families that come along that are seeking only a single service. I've heard many times, as you all probably have, when a customer comes to us, when a person comes to us seeking help at the agency, they want a specific thing. They've come for fuel assistance or housing assistance, and that's all they want. They want that single service. And we're proposing that you cannot expect that this single service is going to change their life. You can expect an immediate crisis averted. You can expect that they may be stabilized because of this tangible assistance, but you can't expect that their life will change. It's just not a reasonable expectation. But if the person wants to make a change, what the research shows us is that the way that support is given to that person makes a difference. It makes a difference in the results. So what do we mean by the approach? We're talking about a strength-based approach here. And this is a graphic from a training program that we're going to talk about a little bit later on that's from Temple University. It's called the Credential for Strength-Based Family Workers. And the idea is that there's a lot of work that's been done in our network and in other helping networks that taken together really mean strengths-based family work. So terms that you may be familiar with: family support, family engagement, family-centered practice, family development, family empowerment. And what we believe is that there are some key elements in each of those processes, those approaches that taken together form this strength-based approach that we're talking about today. So, for example, family engagement, it really stresses the family's participation in decision-making and strength-based partnerships with the families. Family support focuses on individualizing the support services that a family needs. Family development, the original family development theory is based on the changes that happen in a family as they move through being newlyweds, having young children, and so on, and how that movement in the family or that development in the family is influenced by the larger society. In the Community Action Network, this term family development has really been used to talk about developing skills and developing circumstances of a family, but there's not considerable research that supports the use of the term in that way. It's just been practiced. I shouldn't say just been, but it has been practiced throughout our network to use that terminology. And so that's part of what we're talking about here. And then there's family-centered practice that really comes from a medical model, recognizing that the family itself really has an understanding of the plans and action steps that need to lead to their well-being. And so it's just as important in our work as it is in the medical model. And the idea of family empowerment recognizes that people who lack an equal share of resources or lack the ability to access and control resources really are at a disadvantage, and that if we can help people become empowered, then it's sort of like teaching them to fish rather than giving them a fish. So those things taken together really are the basis of the strength-based approach. These are really all these approaches, but the sum total of them are about what we call capacity building. And this is adapted from some research that's been done by a group in North Carolina, the Orlena Hawkins Puckett Institute. And it talks about capacity building models as opposed to what you might think of as traditional models, whereas the capacity building model, the strength-based practices, really promote developing skills and knowledge rather than just intervening for a specific problem. It's about families setting their own goals rather than a program or a service or a professional setting the goal for the family. The capacity building model is resource-based so that you can meet those empowerment goals that I was just talking about, so that individuals have access to resources rather than just receive a service and then go on their way. And then I love this one, providing services to support what's strong as opposed to providing services to fix what's wrong. It's a funny little way to say it, but it's an interesting juxtaposition to what your expectations are for the individuals who come to you seeking help. So what what we're seeing in the research is that the strength-based approach is really the foundation for a true results orientation in an agency. And when we've talked about the National Theory of Change assumptions, one of the assumptions is that community stakeholders, particularly those who with low income who are coming for services, know best the needs of their community. And so if they know that, there's an assumption that they know their situation and that will help them be able to work towards results on their own with the help of the relationship with the agency. For this toolkit, we are going to focus on family-level outcomes. We're going to think about this approach as being effective at the family level. We know that it really needs to be used for agency and community level outcomes as well. But today we're going to just look at this little piece of family level outcomes and look at the 6 national goals with the idea that we'll look at the 2 that are really family focused. And these are about changes that happen when families receive services from a community action agency. And I know that all of you out there know the 6 national goals by heart. And but the 6 national goals imply a change in status of some kind. Individuals with low income become more self-sufficient. They don't just come and receive a service and are gone. And even goal 6, which is what we usually think of as the area where we report outcomes that are really from services that are designed to help people become stable, we're really looking at that stability as the outcome for that sixth goal. And you'll remember that it's currently stated as they achieve their potential, that vulnerable populations increase their support networks. So if you're really talking about how that change happens, they increase their support network, they achieve their potential, they become more stable, there's an assumption that there's going to be a change. So the concept of focusing on family strengths isn't a new thing. In fact, it is at the heart of what community action is built on. And several times throughout this presentation, I will refer to things that are considered new and innovative concepts, which really are built on the core principles of the Community Action Network as established back in 1964. So 50 years of focusing on family strengths has been has produced outcomes, certainly, from community action agencies, but because we have not been focused on the collection of evidence and the presentation of our evidence, what we end up with is service counts, and we need to really think about how we can change our discussions to be more results oriented. So this idea that focusing on family strengths might be responsible for more success than other approaches is new in the research. It might not be new in your minds, but it's new in the research. And so there's a growing body of research that's connected to the strengths-based approach. And some of the areas that are touched on in the toolkit are family empowerment, family well-being. There's a lot of research that's about using family or strength-based approaches with parents and children together, and the adult outcomes are improved parent judgment and improved parent ability to evaluate their children's behavior. coupled with an overall improvement of confidence of the adult family members who are involved in the project. And so this is another piece that's taken from the Credential for Strength-Based Workers from Temple University, and it's what we call the help-giving cycle. It starts here at the top with engagement and relationship building, and it proceeds through a cycle of help giving that is joined by trust at each of the junctures. One of the key pieces of strength-based family work is this relationship building and the trust that needs to be established. And you can't do that. You can't establish trust, and you can't establish a relationship if you are providing a single service or a short-term interaction with a family. It's not a reasonable expectation at any rate that that your staff, your direct service staff or volunteers are going to be able to establish relationships. And so the cycle of helping someone really goes through the process of assessing where they are, setting goals and prioritizing, doing some planning with the person, letting the person set and plan their own goals, and then identification of resources that they can use or they can establish or they can create or they can develop to help to fulfill their plan, and then identification of the results that are expected and how the progress towards those results are going to be tracked. Then a review, which is the arrow in the middle, based on progress and new situations that leads to a reassessment, with that overarching engagement and relationship building being a piece of the process. Now, this doesn't happen without time. So if we're going to think about the Community Action Network as being engaged in a strength-based approach, a results orientation, then we have to understand that what works in terms of giving help, hand up, not a hand out, as many of us know that motto, it's really going to take some time. It's not something that happens haphazardly or easily. And so I of course have to always show the ROMA cycle in every time that I speak to anyone, and I jokingly say, does that help giving cycle sound familiar? Well, it should, because what we have in the results oriented management accountability cycle is a similar set of activities that are usually thought to be, the core activities of an agency. An agency should be involved in assessment, planning, implementation, achievement of results, and evaluation. But that really is paralleled with what happens at the individual family level with the worker that does the direct service. So what I have here is a little comparison between ROMA in action at the agency level and ROMA in action at the family level. And I think that's a key piece for us to understand, that we are looking at using the same guiding principles that we have in the ROMA cycle and applying that to work with families in a strength-based way. So I think this is, unless there are any questions, we have a couple questions, it looks like, in the group. I can take a pause now and answer them. Cheshin, are the questions coming in the chat?
I've seen a couple of questions that have come in the Q&A, but it's mostly been things about the recording and the materials and that kind of thing.
Okay.
But we do have one note to make sure to provide all of the references for everything that you've cited today, so we may want to look at how we are going to present that information back out.
Okay, and the references are included in the toolkit. There's a reference section, so that'll be available. That'll be available throughout. So, okay, great. So why is this kind of approach important? And it's because we know that problems aren't simple. They don't come in little packages. There are a problem in one area of life, and we often talk about different domains, education, housing, employment, transportation, and so on. Those domains are interconnected, and that a problem in one area of life can be fixed, or it can actually be made worse by something that's happening in another area of the of life. So that's the basis of what we're thinking about, and that we really need to think of observing changes in multiple domains to see that's what helps people move forward. That's what helps people achieve self-sufficiency. And the issues are multifaceted, and it's not just in one area. So a lot of agencies use scales or matrices to track these different domains across the life approach. And I would say there's a question that came in, does everyone who walks in the door need to have this kind of service? And I think the answer to that, in my opinion, and of course this is just my opinion, is no. Well, actually it isn't just my opinion, because I'm backed up by David Hunter and Mario Marino, some local or some other experts in the field. Hunter talks about two populations that an agency provides help to. One is the target population, and that's the population for which they expect to see outcomes. They expect to see change, and it's those that target population for whom this kind of service, this multifaceted, in-depth, help-giving cycle kind of service is appropriate. But the other kind of population is what he calls the service population. And these are folks who get services. They only want a single service. They come for that service. And so that's the level of service that is provided to them. But we can't expect that we're going to change their lives, and we need to be thinking about what we do for them. And they aren't achieving outcomes in the same way, and we shouldn't confuse reporting about these by talking about the entire population in the same way. So yes, the concern and the expectation really is that there would be a target population. And so what we've talked about is that some of the individuals in an agency gets what's being called bundled services. And I've got a couple examples, different examples of bundled services. And so the most famous one is the Annie Casey Foundation Center for Working Families report. They developed a model where they spoke specifically of bundled and sequenced services, not just one service, but a series of services that have multiple components, rather than just saying, here's our menu of service and allowing participants to sort of figure it out on their own. The bundle of services provided in a way that allows the individual, the family, to to go through a series of services. So the hope, and this is from the Center for Law and Social Policy report on the NEKC work, the hope is that the service will have more than additive effect. So the whole is greater than the sum of its parts. And effect in what? Remember, we want to know what is it that's going to change. And so the things that they thought were going to change were promoting economic security, enabling clients to resolve immediate crises, acquiring skills and credentials, getting a better job, and building the savings needed to prevent the crisis the next time. And so that's what they were measuring, and they had a menu of services, and they found that clients who received bundled services were 3 to 4 times more likely to achieve a major economic outcome than clients receiving only one type of service. So delivering this kind of integrated service produces outcomes 3 to 4 times more often, and they have this caution. Delivering integrated services required well-planned program design, hiring and training staff with strong skills and backgrounds, and the thoughtful use of technology and data collection. So this is something that requires effort, planning, skills, and so on. And so it's something that you don't go into lightly. Here's another example. And I found this one to be kind of interesting because it's outside the realm that community action sometimes works in. Pediatricians are really concerned about this concept of toxic stress levels in children. And so they're finding that children with chronic or recurring illnesses really have something in common, and the commonality is that they have this high level of stress in their lives, and the stress is really something that their adult family members appear to be unable to deal with. So multiple adverse conditions, so you lost your job, you're losing your housing, and you have a sick child. I mean, multiple conditions, socioeconomic disadvantage, no buffer, no ability to meet the basic needs of your family, urban poverty and community violence, compounding the adult family members' ability to deal with stressors. And so they've identified this as a 2-generational problem, and the family's distress finds its voice in the child's symptoms. And I think that we've all seen that. We all understand that this is happening. But it's happening at a rate now that has pediatricians really concerned, and so they're reaching out to human service professionals in the communities to do a community level response to the problem involving supports for both children and adult family members. So that's an example of a 2-generational bundling, but the 2-generation approach that we've been hearing a lot about really is, it doesn't start from, I thought that one was an interesting example because it starts from a medical professional seeing the symptoms of this problem in the child's distress. But so the Aspen Foundation has a program that it calls Ascend, and Ascend identifies 3 components to what they're identifying as the 2-generational approach: education, economic supports, and social capital. And they're also seeing that health and well-being is an emerging component. So they're coming to the health process sort of in the other direction than the pediatricians did. So I thought that was interesting. And Cap Tulsa is one of our agencies, one of our CAPs, that's currently engaged in this work that Aspen Foundation and NECASE are doing. And Tulsa started out as being a national leader in early childhood education, and they chose that as one of their priorities because they saw the research showing that high-quality early education is an important aspect for a child's future. But they also found out, and what they're saying is, and we're also surprised, that the early educational piece alone is not enough. And so their two-generational approach integrates high-quality educational opportunities for young children and education, workforce readiness, and parenting programs for the parents. And this is the graph or the continuum that that has really come to be the two-generational approach, where we start on the extreme left with a child-focused approach, early childhood education, and then we move to a parent focus, which a lot of agencies have had an adult focus program, to really thinking about how do these programs interact with each other. So again, here's another case where this is not new to community action. We have been doing Head Start programs. The Head Start funding was developed the same year as ours. It was developed from the same mindset, from the same legislation. We have been doing the two-generational approach for 50 years. So we really need to think about how we talk about that and how we explain that and how we talk about that. So how do you help change happen? And you know, isn't this part of the problem? The people who come to agencies seeking help are often seeking that short-term fix. They aren't interested in this kind of in-depth service. So what the research has shown us is that the role of the direct service worker is key. How does the worker do the work? How important is it? And what support is needed? So NASCAP did a case study, oh geez, it must be about a year ago now, that we were doing this work on bundled services and looking at agencies in our network that volunteered to be interviewed about this bundled services concept. And this study is on the NASCAP website, so you can go to that website to draw down this study with the references included in it. But some of the things that we found, I'm trying to get it to turn, was that we learned lessons learned about the role of staff. So it was fun to look at the title of the person at the direct service level, and that title was very different across the agencies that were interviewed. Could be a parent involvement coordinator, could be a family development specialist, could be a caseworker, it could be a navigator. The terms were very different. They're very different for this person, but there was seemed to be a key person that was vital to the success of these bundled services programs. That the services didn't happen accidentally. They happened with the concerned comprehensive delivery through a staff person or a set of staff people. And throughout the term of getting the clients and moving through the process, this information is coordinated by the staff person. The staff person provides a sounding board and helps to think about how to solve problems, monitors, documents progress, and helps the family make changes in their plans as a result of the information that they gathered. And one of the things one of the things that we talk about is what kind of training, and it's clear. The Annie Casey Foundation talks about it. The Aspen Foundation talks about it. The staff person who works with the families in this kind of a program needs specific skills. They need to be able to encourage and provide support. They need to have insight to help families when they're doing their plans, and they have to have a knowledge of the community so they know where to send people to get help. And training is absolutely necessary, and not only training, but the opportunity for networking of staff so that they can learn from their peers. So to achieve a results-oriented agency, direct service staff must be competent in applying strength-based practices. And this is just one example of a national training. This is the Temple University National Family Development Board program called the Credential for Strength-Based Workers. And it is a competency-based program, and here are some things that are part of this training. That individuals understand and embrace a set of guiding principles, that they have a positive attitude related to the abilities of the people who are seeking help, and that they have knowledge and skills to facilitate action. And they understand how to apply strength-based principles in all aspects of their work. Now, this is not the only training program that's out there. There's, I know the Washington Community Action Association, the Illinois Community Action Association have a different format and a different kind of training, but they're similar in terms of them being strength-based. The Temple program is unique in that it develops competencies and that it's college level and produces college level credits. So it's unique in that way. But the second and very important piece of this whole implementation process is that agency policies and practices have to support the implementation. And I saw a note, one of the questions is that if the EDs don't fit into this model, or they don't embrace this model, then it's not going to happen. And that's true. It's also true that the board of directors of the agencies have to buy into it, that staff have to have both the training, of course, but also they have to be able to practice what they learn. They need ongoing support and monitoring, and they need periodic evaluation of their ability to help people move towards success. And so the agency assumptions and expectations should be results-oriented. And so the agency has to say, we're going to support well, here, wait, let me get this up here, the development of a strength-based agency, a results-oriented agency. And so I mentioned David Hunter before, his book, Working Hard, Working Well. I just pulled out a couple of things that that may be controversial, and I throw them out for you to think about. Performance management systems must be useful. So if you have this whole data collection process where you're getting information from the direct service workers and you're reporting it up through the national to OCS, but what information does the staff need? What do they get back? What's the feedback loop to the staff? So performance management systems must really be useful. And when we talk about ROMA Next Gen, we talk about using the data. Well, in order to use it, it has to be useful. So that's why I like this quote from Hunter. Another suggestion from Hunter is that regular monitoring and communication are important. And so not only do direct service staff need to have training and ability to implement, also the supervisors need to be able to monitor and communicate with those staff to help them. It's hard to stay positive. It's hard to stay strength-based in the face of folks who may be resistant to change. And then to tie the staff's use of performance management to job descriptions and performance reviews. I'd say this is probably the most controversial thing that David Hunter talks about, is how the staff's performance could be evaluated based on the outcomes that are achieved by the help seekers. So as I said, that's a controversial piece. So one of the questions is, how does the concept of bundled services fit in with the idea that low-income individuals know best what the needs of their community are? I think the question, and I'm going to interpret the question, and if I've got it wrong, the person who submitted it can correct me. But the idea is that if I know what I need, and I only need one thing, it's the only thing that I need. I do not need bundled services, and I come to the agency to get that single service, then I should not be expected to have bundled services, because if I'm offered or if I'm given bundled services, then the idea is that I might not, the assumption might be that I don't really know best, and I really only need this single service. And yes, I think that's true for some individuals. Remember that service population. There are certainly people that come for service who say they only need one service, and they do really only need one service. But there are a lot of other people out there who come for service who say, I only need this one service, but as you talk to them, and if you have time to establish a relationship, if you have the opportunity to get them to talk, to help them to open up, they are very much in need of additional services, and they know that. It's not that they don't know it, but when they come for a single service, they are talking about just that service. And so I think it's just a way of how the services are presented and what's available to people. So I don't think that it's a contradiction at all. I think that we're not talking about every single person who walks in needing a bundle of services. So I think that's a piece of it. We have a couple activities from the toolkit. One of them is a set of surveys. Remember, we're looking at this idea of, are we talking about results? And I'm going to switch over here to this copy of the survey just to give you a peek at it. But so this is a survey that you would ask the direct service staff to think about, and they're paired statements, and you're asking people to think about their own work or their own orientation. So when asked about my job, I primarily talk about what I do. Or when asked about my job, I primarily talk about what changed and what was accomplished by the families and communities I serve. Now, I've been in the field for a lot of years, and I always say, go around the room and tell us a little bit about yourself. And people will say, this is my name, this is my job title, and this is what I do. It's the logical thing to say, but it's only logical in terms of what we've been taught to say or what we've achieved, we've experienced. But wouldn't it be fun if everybody said, my name is Barbara, and what I do in my agency is I assist people become more self-sufficient, and people become self-sufficient as a part of what I do. So it's not typical in our language, but it could certainly be. And then some ideas that I think about my work in terms of applying the rules of the funding sources, or in terms of helping families and community change for the better. It's two different ways of thinking about your work. Now, in this piece of the survey, I often see people checking both A and B, because you have to know the rules, you have to apply the rules of the source the funding source, or you lose your funding if you don't meet the rules. So we're not saying that people should not do A, but that B should be a choice as well. So I think of myself as a staff member of a particular department, or I think of myself as a staff member of the agency. That agency staff member is really more thinking about bundling services, even though that term may not be part of what they're thinking about, but they know all of the things that are happening in their own agency. They're able to make referrals. They're able to quickly provide support services. So if someone's only coming in for fuel, you may also know that they're hungry, and you may be able to provide a referral. So that agency staff thinking is different from being a staff of a particular department that's focused on a single part of the domains of a person's life. So and you can see there's 10 items here. There's only 10 items, but you can see that that's the sense of what you're asking staff people to think about. So that's the staff survey, and then the agency survey is very similar. And let me see. I think that you can see that well enough. I think you can read that. Let me just zoom in a bit. Okay, let's see. I think that helps. This is the agency statement. Now, your board, your upper management staff, or even your direct service staff could be thinking about what do I believe the agency's perspective is. Does the agency publicize what we do, the services we provide, or what happened as a result of the services? Do the agency policies and procedures are they compliance driven, or are they results driven? Does the agency's strategic plan identify what each individual department or funding source will do, or does the plan say this is the agency-wide theory of change, and these are how the individual departments fit into it? I mean, it's a different approach. So let's see. We believe it's up to our director and upper management to determine how we serve, or we include participants of the service. And there again, we're asking that those folks who we believe know best be part of the strategic planning process. Do we protect our turf, or do we value partnerships? And as I said, this isn't just an either or, but the idea is that you come up with a total, and if you only have A choices, then you can think of yourself as being more service oriented, and if you have B choices, you're more results focused. So that's one of the tools in the toolkit that we think will be interesting to you. Another is a picture. This is taken from a book called Empowerment Skills for Family Workers, and it was printed about 2000. This is from the instructor's guide. So here's the picture, and it's a line drawing, and it shows a home with a lot of interesting aspects to it. And the goal is to find strengths in the family. I'm thinking that maybe if anybody had a couple of things they would want to put in the chat window that they see as a strength in this family. And while anybody is throwing in some ideas in the chat window, we're starting the portion where we're going to ask you to do a few things. And this is the first one where if you see a strength there, you might put it in. But there's a question: any research into the use of the Strengths Finder as a tool for assisting staff to understand their own strengths? I know there's been a lot of agencies, not only Community Action, but other human service agencies that have used this Strength Finder, and it really is, it's got the same principles as this strength-based approach, but it's focused on helping staff understand their own strengths and their abilities. So there certainly is a place for that as well in our discussion about the strength-based approach. So I'm wondering, the child is running to the father is one. Very nice. Yes, there looks like some good love there. The family's housed. They are definitely housed. They have a home. They have food. The dad's being welcomed home. There's fruit there. There's that real good relationship there between the father and the child. So they have electric because the TV is on, and there are pets, which helps to provide empathy in those young children. And it looks like he's coming home from work, so he has a job, and there's food, and there's family photos. So look at all of those wonderful, wonderful. Thanks, guys. That's a good list of strengths that you were able to pull from that picture. And just in a quick couple of minutes, we were able to get a whole range of strengths from that picture. So sometimes it's just a matter of your focus. Do you see strengths or do you not? So here's also another piece. There's the guiding principles from the Strength-Based Family Worker curriculum are listed, and then the survey that's in the toolkit, the survey document asks, how much do you believe this? Do you believe that all families have skills and abilities, and also varies in challenge? A lot or a little bit, because maybe you believe that not all families have skills and abilities, and that's one of the problems that you face. So it's just a way of saying how much you believe these guiding principles, and there are 11 of those principles that are part of this process. I want to go back because I forgot to ask you the poll questions. And the poll questions are about the the bundled services concept. And I have just 3 quick questions that we'll ask in a row that are about your involvement currently with this bundled services concept. And so, Keshan G, I'm sorry, I just went right on by here. The first poll question, does your agency provide bundled services? As we've defined it as a comprehensive sequenced set of services, and then if so, either does your agency provide it or does your agency work with other partners to provide it? Because sometimes we forget that we're involved in bundled services even though our own agency isn't doing all of the services. It's like that pediatrician. He was getting human services from around the community to be engaged. And so then if the answer to questions 1 and 2 are yes, would you identify the bundle to be child-focused, adult-focused, or 2-generation focused? So I'm going to ask that be posted and that people have a chance to answer those 3 quick questions.
Sure, and that poll is open on the right side of your screen. We have several people that have started getting their answers in, which is fantastic. You do have another 45 seconds or so to get your answers in. We did put all 3 of the polls questions together, so it's 1 poll, 3 questions. So, and we will post up the results at the end. You will not be identified in this, but we will get an idea of what the crowd is thinking today.
Just give us a sense of there's about 125 people on the call. We'll get a sense of those who could get into the poll before it closes, and get a sense of what what this group is doing in terms of bundled services, whether that's something that's happening already or not happening. So it looks like the poll has closed, and Cashin is going to get us an idea of what the group said.
Sure, it looks like there was a few people that were in process, so we'll try to capture those and then should get those out to you momentarily.
Great, thank you so much. Okay, it looks like of the people who answered, the majority were yes, they provide bundled services and they work with other partners, and a lot of them do the two-generational outcomes. So it's something, and I think this is an important thing for us to know and be able to talk about as we go through this next year, that we're able to very clearly articulate the bundling of services that we do already, that we're already involved in. So this is not a new concept, but we need to be able to talk about it and think about how this strength-based, results-oriented approach, it really makes the difference in terms of the outcomes that are achieved by the folks that seek help at our agencies. So I'm at the hour mark. Oh, I'm a little over an hour. Just to leave you with a thought for additional discussion, that we really need to apply this strength-based, results-oriented approach to community level work. That this is not, we say very clearly that that we know that family and community outcomes are intertwined, and we know that outcomes on the community level can be impacted by this strength-based approach, and that families and communities depend on many different service systems that have different goals and objectives, and that if we can put this together doing community planning, that it will be effective in developing and sustaining these collaborations, and to do that hard work that that's necessary. And we know that skills, not only skills, but attitudes are very important. Those are part of the competencies in the strength-based family worker training, both skills and knowledge and attitudes that help to apply this results orientation. So I think many of you know how to get a hold of me, but if not, you can always do it through either NASCAS or the partnership, and I'm available to answer any other questions. So were there any other questions that came in at the end?
I think we do have a couple of others. We'll start you off with the easiest one. How to find out more information about ROMA training and becoming a certified ROMA trainer.
Okay. There's a website that's www.roma-nptt for National Peer-to-Peer.org. There's some information on that site about how to become a certified ROMA trainer and an application process, and a contact me with that you can send questions to me that I get that information.
All right, thanks. Next up, can you talk a little bit about how you would talk to your clients and get them interested in pursuing such in-depth services?
Well, I don't think I have time to talk about that today. I think that's the topic for discussion, and I think that if you look at the NASCAS Bundled Services document, you'll see some of the approaches that were taken by the individuals there. There's a lot of best practice out there just by looking at the people on the call who are engaged in bundled services to be, I mean, they're really the experts to say how they got people involved, and we might be able to set up some sort of a blog, or, you know, I don't want to say learning community, but something that would be a way for us to be able to share best practices about engaging people, because remember, it's about the population that you're working with. Your population might be very different from another population, and so what you'd want to be able to do is find someone who's worked well with with your population or similar population that could give you some pointers on how they got started and how they set things up. And Bruce, I wanted to say, I think you said it's important to note that how many answered no answer. I think that was just because of the time for the poll. We only had 2 minutes, and I talked through the first half of that 2-minute period, and so people didn't necessarily know they should be doing it. So part of that's the delivery of the poll, and so people didn't have a chance. But I do think it's important that that no answer, that we mention it. So thanks for bringing that up.
Yes, thank you. And like I said, I think that was a part of it as well. Next question up here. Can you talk about how bundled services fits in with the assumption that low-income community stakeholders know best the needs of the community? Can you talk about the relationship there?
Yeah, Keshan, I think I did talk about that one. I saw that one in there, and then I talked a little bit about it, that I think the assumption is that people who come for a single service know that they need a single service only, and that if we insist that they need multiple services, then we're disregarding what we know, what they believe to be true. But I think that you're looking at a large number of people that are being served by our agencies, and we just need to provide opportunities for people to identify at what level they would like help and be respectful of that level. So I don't think it's a contradiction at all. I think it's we just want to be sure that we're saying this is not about every person getting this kind of bundled service, but it is about saying that we know what works is multiple services. We know that if people are going to move towards self-sufficiency, that a bundle of services does work, and we have documentation of that from many different kinds of research. So, so I think that's what that question was about, but I could be wrong.
Sure. Thanks for the revisit there, then.
Yes.
Let's see. Next up, has there been any discussion on creating standardized measurement tools for use in the network? Sure.
Yes, there has. I think Davita's on the line, and she and I and some other folks that are working with the NASCAS's ROMA Next Generation Center of Excellence have been looking at the national performance indicators and trying to figure out ways to capture outcomes that are connected with more than one service. So one of the things that we talked about at the NASCAS conference was how, you know, you can have one service that achieves one outcome, or multiple services that achieve one outcome, or one service that achieves multiple outcomes, or multiple services that achieve multiple outcomes. And so the idea is how to get that complexity into a standardized national report that everybody is going to be willing to use, because it's different from what we are already been doing. So yes, there's plenty of discussion about that, and Christine would love to have more we'd like to have more discussion about that.
All right, thanks. And while we see if there's any last second questions that come in, I did want to remind everybody that this is being recorded. So the recording will go up on the resource bank at www.csbgtta.org. We're usually pretty good about the next day, but we will send out an email to everyone that's registered with information letting you guys know that the recording is available and how to access it. We'll also have the slides available at that point. And if you are looking for the toolkit either in the resource bank or from the partnership's website, the actual name of the guide itself is Utilizing a Strengths-Based Approach to Implement ROMA Throughout the CAA. So utilizing a strengths-based approach if you are looking for it on our website then. There will also be an evaluation that will pop up at the end of today's event, so we do appreciate you letting us know what you thought about today's event, what can we improve on, and what kind of topics would you like to see from the partnership going forward. So with that, it looks like the questions are slowing down.
Yeah, it took me forever to do this, but I got the toolkit cover up so people can see what they're looking for.
Sure, that should help there. So like I said, do take a look for that. The tools that Barbara mentioned, such as the surveys, that picture, for finding the strengths, those are all located in the toolkit, so you can download those as well. So it looks like the questions are slowing down. If there are questions that come up after the fact, please don't hesitate to email us here at the partnership. We'll do our best to answer or at least get forwarded on to Barbara for answers. And are there any closing thoughts that you want to leave everyone with?
No, just thank you very, very much. With all the things that are happening at the end of the year, I appreciate your attendance and looking forward to making some additional input about strength-based family work.
All right, then. Well, thanks, everyone. Have a fantastic afternoon, and do, of course, get in touch with any additional questions. Hope to see you on the next webinar. Thanks, everyone.
Thank you.